to the lotus feet of Paramapujya Jagadguru, Padma Bhushana, Shri 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 Dr. Balagangadhar Nath Mahaswamiji. Humble pranams to the holy feet of Paramapujya Jagadguru, Shri 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 Dr. Nirmalanandanatha Mahaswamiji, and pranams to the holy feet of Shri Shri Swaminatha Swamiji. Myself, Dr. Sindhura, Assistant Professor, Department of Kaya Chikitsa, Shri Kalabhairaveshwara Swami Ayurvedic Medical College, Hospital and Research Center, Bengaluru, would like to give you a heartiest welcome to the pre-conference workshop on Research in Alternate Medicine, a PRIME, organized by Unnati Healing Foundation, Bengaluru, India, in association with Bangalore Zone Ayurveda College's Principal Forum on account of Azadi Ka Amrit Mahotsav. Now, I would like to request Dr. Saraswati Hegde, Founder President, Unnati Healing Foundation, Bengaluru, India, Dr. Ahalya Sharma, Principal, Government Ayurvedic Medical College, Bengaluru, India, Dr. Kiran M. Gausar, Principal, Shri Kalabhairaveshwara Swami Ayurvedic Medical College, Hospital and Research Center, Bengaluru, Dr. K. Chidambaramurthy, Principal Scientist, Ramaya Medical College, Bengaluru, India, Mr. Shivaraj Jain, Statistician, Ramaya Medical College, Bengaluru, India, to come over the dais. Please, sir. Now, I request Manasvi, final year UG student, for invocation.
शरणु सुरगण सेविता शरणु गजमुखा वाहन शरणु सुरगण सेविता शरणु सकलाभीष्टदायक शरणु विघ्न विनाशका शरणु सकलाभीष्टदायक शरणु विघ्न विनाशका शरणु शरणम्बे हे मखचित किरीट कुण्डल कामिता फलदायका हे मखचित किरीट कुण्डल कामिता फलदायका अमित सौलभ्य प्रबल शास्त्रोद्धाम विद्या सुरनिधे पाशमोदक परशुधर फणि भूष पार्वती नंदना वासवांकित विजय विठ्ठलन दास भोगणनायका वासवांकित विजय विठ्ठलन दास भोगणनायका शरणु शरणम्बे शरणु शरणम्बे शरणु शरणम्बे
Thank you, Manasvi. Shubham Karoti Kalyanam, Arogyam, Dhanasampadam, Shatrabuddhi Vinashaya, Deepajyotihi, Namostute. I request the dignitaries to light the lamp as a symbol of prosperity and inaugurate the function. I request everyone to please stand up and read down their mark.
Sir, one pencil bit if you want.
To raise awareness and to share the information about the transformative and most appropriate research methodology for use and validation of alternative and complementary medicine. Research in alternative medicine, how to start the process is the theme of today's pre-conference workshop. Welcoming you all on this occasion, without further ado, I would like to invite Dr. Kiran M. Kaushal, Principal, Sri Kalabhairaveshwara Swami Ayurvedic Medical College, Hospital and Research Center, Bengaluru, for welcome speech.
Namaste to all. My humble pranams at the lotus feet of Parama Pujya Jagat Guru, Sri Dr. Balagangadhar Nath Mahaswamiji, and my humble pranams at the lotus feet of Parama Pujya Jagat Guru, Sri Dr. Nirmalananda Nath Mahaswamiji, and Pujya Sri Soumya Swamiji. Today, we are able to conduct this event only and only because of Dr. Ahalya Sharma Madam. Dr. Ahalya Sharma, who is the principal of Government Ayurvedic Medical College, she is an inspiration to so many Ayurveda graduates all over Karnataka. We were first inspired by her, maybe way back in 1995 or 94, I don't exactly remember, when there was one function done in the Indian Institute of Science and Madam Asian Medical Students Association of. And Madam gave one speech. We were all so inspired by her talk that from that day onwards we went on following her. Today, when Madam asked me to be one of the co-organizers or conduct this program in our college, that is when you will be our college, from Bangalore Zone Principals Ayurvedic Principals Association with the Unnati Foundation. I said yes. I did not ask what the function is, because I was very sure that it would definitely be a useful program for all the students. That is what impact Madam has given on all of us. From Sri Kalabhairaveshwara Swami Ayurvedic Medical College and management Sri Aditya Trust, I wholeheartedly welcome Dr. Ahalya Sharma Madam for this function, and I request Dr. Shailaja to please. Dr. Saraswati Hegde, President Unnati Foundation. I wholeheartedly welcome Dr. Saraswati Hegde from our institution, and I request Dr. Shailaja, please welcome. I also wholeheartedly welcome Dr. Chidambar Murthy. Sir is said to be one of the resource persons for today's program. And I request Dr. Nayan sir to please welcome sir on behalf of our college. I am not introducing the guest because Madam is going to introduce the guest. So I'm not introducing the guest to ensure that we cut short the time. I also introduce or welcome Dr. Shivraj on behalf of our college, and I request Dr. Nayan to please gather. I also wholeheartedly welcome all the principals of Bangalore Zone Ayurveda colleges. One of my seniors, Dr. Ganesh Puttur sir. Sir was my senior in post-graduation. And all other principals of Bangalore Zone, I wholeheartedly welcome you all and all the post-graduate students and the internees as well as the DMA students who are all gathered offline and online. And all the staff who are here supporting us for all these functions, I wholeheartedly welcome you. Thank you.
Thank you, sir. Now, I request Dr. Saraswati Hegde, Founder President, Unnati Healing Foundation, Bangalore, India, for introduction and purpose statement. Giving a brief introduction of Dr. Saraswati Hegde. Dr. Saraswati Hegde is a TEDx speaker, researcher, spiritual scientist, and a writer. Dr. Saraswati Hegde, holder of a doctorate in the subject of pranic healing, has been an effective figure in social service for the past 25 years. The organization she founded, Unnati Healing Foundation, is an NGO that employs the ancient techniques of yogic healing as a supplementary therapy for ailments involving the physical, emotional, and mental aspects of health. Dr. Saraswati Hegde was a principal investigator heading the Department of Yoga, Vidya Pranic Healing in various research activities at the MS Ramaya Medical College, Bangalore for more than 10 years. Having been in the service field for so long, she continues to strive to uplift the society in various ways with her most recent and full-fledged effort on personality development of school-going children and adolescents. The commitment to serve is ever present in her, and because of which her energy is infectious to all the youngsters that volunteer. Over to you, madam.
Good afternoon to everyone. Namaste. My deep salutations to the divinity within you all. You are all Veda Adhyayis, Vedadhyayis. So the great salutations to you all, firstly towards you, then to the people, the great stalwarts here. This is a beautiful opportunity for all of us, right? We have to count our blessings. The first thing is count our blessings. If these two stalwarts, especially Dr. Ahalya, was not taking this initiative to organize this beautiful program, it wouldn't have happened. Internally, be thankful for their effort, their care, their commitment, and give a big hands up. Be thankful. And Dr. Kiran and the whole team here, including with their blessings of Swamiji's, This place was made available, the whole setup is made available for us, isn't it? Think of 1 second about all these countless blessings and let us say thank you. It goes on, right? I'll just share, this is an overwhelming session for me to give an introduction about this program. In 2008, when I was invited to Chicago, America for ACCA conference, I got an opportunity to interact with medical doctors in the community. I was under the impression, as you are all having, it is totally developed countries. Everything is set. They are much higher level than whatever we are imagining. With that intention, I was trying to interact with them. For my surprise, I realized the community, maybe around 15 medical doctors I was interacting with. They mentioned treating the disease through the chemicals, we are reaching to like a kind of dead end. We are looking forward towards Eastern countries to treat the whole world, to bring a holistic health. Imagine the mental status in the community. I was under the impression our country and our tradition is at lower stage because they show up so much. That day something went inside. If the whole world is looking at India to take up the responsibility of holistic health, who can do that? Can it be done by the politicians? Can it be done by any other medical streams? Maybe to a certain extent, but it is possible completely from Ayurvedic because it is a very, very deep external science and inner science. It's an art and science of life. Most of the time we talk more about the art, how to live better, how to manage health better. We talk it like artistically, we make it as part of life. But research is the language of science. We are not talking in that language where the science can be reaching out to the whole world, especially during this pandemic. What is that the whole world have witnessed? That should be documented. It is not just the cough syrup or other things which has helped. It is the regular medication that is in the kitchen, the prayers, our lifestyle, which was really helping the whole community. People became much more healthier. You were talking about the science, it was demonstrated. Dear friends, it is a time to take the responsibility to serve the whole world. The responsibility is on your shoulders. Many times we don't realize because we are in the same environment, you are seeing the same people, same process. You don't realize the need of the world, need of the hour. Once you come out of your box, your structured thinking, you realize the importance of your knowledge, your studies, your subject. It has a complete science. Unless and until you open up your heart, your mind, your approach to study it meticulously and present it in a systematic way, the language which can be understood by the whole world, you'll not be able to reach more. So 2008 to 2021, today that dream, that vision of reaching out thousands of students has come true. And also we have realized that this is not just dealing with the matter, it is more also with the consciousness. The research methodology, which can be used for matter or materials or the medicine or the chemicals will be different than for the consciousness. What we deal is more subtle energies. Sattva vriddhi. Raja and Tamo gunas should be suppressed or diminished and the Sattva vriddhi should happen. It is a very, very subtle. It's not gross. It needs different approach. In Unnati Healing, we deal more with the energy, pranic energy. Last 20 years of my journey, I have realized research is very, very important. Earlier, I used to demonstrate, if anybody comes here, I can heal their pain in 2 minutes, 5 minutes. I can make somebody see things more clearly in 10 minutes, which is highly impossible through the medication, but it won't prove in terms of research. It may make people to believe, but it won't make system to accept. It needs meticulous documentation, meticulous understanding. That is what even in MS Ramaiah Medical College, I got an opportunity to heading the Department of Pranic Healing. We are documented. Everything should be documented under the research parameters. That we have to bring it into our practice. For that, we got a beautiful team from MS Ramaiah Medical College, and the entire university has supported. Isn't it a beautiful thing to transform ourselves? Instead of looking at our limitations, looking at the need of the world, and your one effort, every year, if you make one research paper, if you all take up one research paper, we have here directly around 200 plus students, and total around 600, 700 students are with me now. If you all present one research paper in a year, Unnati is with you. We will guide you. We will guide you the research methodology. We will help you. We will provide the community support. We will provide the patients. Every support we are willing to extend. How much presentation can be done? You know that the regular lifestyle change can make a lot of difference, but it should be documented and made available to the world. That is what is required. Are you going to be with me in this journey? Yes. You should tell to yourself, yes, it is my commitment hereafter to publish one research paper. It may be community-based, it may be lifestyle-based, it may be, you know that it works. It should be systematically documented. Are you with me? Shall we take up this responsibility to serve the humanity, to make our life better, make the world's health better? Are you with me? I can't hear. Yes or no? Very few. Yes? Are you making a commitment to yourself? Are you capable of doing it? Interested? Do you have that kind of support? Yes. You should say yes. That is how, when you tell yourself, yes, I can do it. If you give a promise to yourself, you will be able to achieve it. Don't give me the promise, give the promise to yourself. Okay? It's a well begun, half done. We have started a beautiful journey. Once again, congratulations and best wishes to you all. Okay? Thank you so much.
Thank you, madam. Now, I would like to request Dr. K.N. Chidambaramurthy, Principal Scientist, Ramaiah Medical College, Bengaluru, India, to speak on the topic, Preparing Your Mind for Research and Research Cycle. Giving a brief introduction of Dr. Kottambally N. Chidambaramurthy, sir. He has done his Development, AIMAT India, and Doctor of Philosophy, Biotechnology, CSIR, CFTRI, University of Mysore. And sir has got his work experience for more than 12 years in India and USA. As a senior research fellow, CSIR, that is Central Food and Technological Research Institute, India, and later he worked as postdoctoral research scientist and associate in Texas and A&M University, USA. Principal Scientist, Ramaiah Medical College, Bengaluru, India. And he is the recipient of Dr. B.N. Patwardhan Prize 2020 12 ICMR Government of India. The Research Publication Award in the year 2014, Government of Karnataka, and SS Mishra Memorial Award, NAMS, New Delhi. We are proud to have you here, sir. Over to you.
Thank you. So my sincere thanks to entire team for having me here. So I started associating with Unnati from last 6 to 7 years when they thought they want to do some research. And I found that they're very enthusiastic and they wanted to have for the first time evidence which was lacking in most of the alternative system of medicine. So unfortunately, I feel very sorry to call our own system as alternate because we failed in proving its scientific merits, and that's why the entire world started using the modern medicine. So being associated with my Ayurvedic faculty from since my post-graduation, because my Ayurveda association is from master program where I did M.Pharm in phytochemistry from Government College of Pharmacy. Ever since I have the association. So basically I decided to talk on two information, like one is on what is the difference between research approach in Ayurveda and modern medicine. So that's one of the information which I wanted to give. And the other information is preparing a mind, like my last 15 years of research collaboration and interaction with medical fraternity has, I spent 5 years in US and came back. I dealt with two different kinds of medical professionals. So recently I did discuss the same thing with ICMR, one of the key person. They said, sir, we have wonderful programs in medical, Ayurveda and other program, but unless we tune and say what it takes the student and faculty to start the research. See, research, anybody can not, research needs certain qualification. It is the mere observation with focus and towards achieving something which is sensible for the mankind and useful for the society. So with that, what I told ma'am is like, let me second talk in our main conference on Sunday. And since Dr. Saraswati madam told today it will be mostly students of collaboration, I thought let me give some information on prepared mind that is required to. So how to move the slides, sir? Can you help me? Where to put? Yeah. Okay. Okay. Right. So we all know that, like by now, most of you are directly or indirectly introduced to the pattern of research. The research starts with collection of information and gathering the information for. Yeah. So gathering the information, we all know that. So we initially start with the point where we identify a topic, we study a lot of literature and identify what is the lacunae that is there in any field. It is not restricted to one field. And then once we identify a topic, we need to do a thorough literature search or what is the available information on that particular topic. And then each research should have a simple hypothesis, basically to see where we have to end. Like if we know the destination, it is easy for us to plan the journey. So similarly, each research, it may be a dissertation, it may be a small project or a bigger project for the country or any population-based study. We need to have a simple hypothesis. Basically, what is that I am proving through my research? Once we have this, then we need to choose a right methodology which is accepted by globally. So as Dr. Saraswati madam was telling, we need to publish a lot of information. We can publish the information only if the method what we are choosing for the research is internationally acceptable. So choosing a right methodology to say what is our hypothesis or prove our hypothesis is very critical. And once we choose the right methodology, then just conduct a research or survey or collect the information, and that is the heart of the research. Then we go for analysis or cleaning up the information. Once we collect all the information, we need to clean, removing all unwanted information, and then analysis of these information. Our colleague Professor Shivraj will tell more on that. And then once we analyze, basically we cannot keep the research to ourselves. We need to present it to the outside world, saying that, see, this is what I found the new thing. And then what we need to do is we have to prepare a manuscript or a presentation. Either you present it in a conference or send it for a publication. So it should not end there. So my sincere request for all the students is research is a continuous process. Whether you become a faculty, you become a practitioner, you become a you start your own industry or whatever it is. So if you are Ayurvedic practitioner or any medical practitioner, please use the research component in your routine practice. Suppose you are a teacher, please use your new knowledge to teach your student and make them learn new things. And if you want to be an entrepreneur, use your research in making up of a new product, because nowadays when Patanjali and other people who have knowledge of ancient system can make a huge company, each one of you has a potential of coming up with your own ideas and it can be used there. Suppose if you want to continue as a researcher, you choose to do research as a full-time career, then what we need to do is whatever outcome you get, just extrapolate it into a larger scale or plan a bigger study using that. And again, for the bigger study also, the entire cycle repeats. And this is never-ending process. If you ask me, research is a never-ending process. And I'll come what research can teach you in life, not in your to get a degree as per the university requirement, what research can teach us in as part of our life learning. Okay, just I will go to that. And I'll just go from my own experience. Like I did my MPharm in 2000, and believe me, I studied till my SLC in Kannada medium, and English was a major enemy for me when I took my +2. Then I did my PCMB. I got an engineering and dental. I said, no, something which is not my passion. I went to pharmacy thinking that chemistry is something which I can do. And this is a person, we say research, he is one of the stalwarts in toxicology, whom I personally met and worked for almost 2 years with him, is Professor Stephen Sape. He owns 5 pharmaceutical companies and he is the head of South American Toxicology Society. And at the age of 81 years, he taught me how to do molecular toxicology in the lab. He was 81 years, and every day 7 o'clock used to come to lab. I used to go at 7:30 and used to prepare all the requirement for me to teach. And I felt humbleness is the so if you see his citation index, it is close to 1 lakh, and he is considered as father of modern toxicology. And used to tell, see, don't expect anything out of research. Keep doing quality work and publish. Automatically, things follow your way. And he is earning is 5 times in royalty and intellectual property than the salary what they give in the university. And he's one of the most prestigious researcher whom I met. And similarly, I recently published a paper on how the citrus lemonades or some of the terpenoids fruit can inhibit pancreatic cancer cell. Because he is specialist in pancreatic cell, I could publish a paper with association with him, and he, not because the subject was bad, he was each time telling, Dr. Murthy, your information is for a common public. Please make it more for a common person. So I learned a lot. Even now we communicate, and that's what I said. Like, it is more of a commitment. And this is the next person whom I just want to. Oh, sorry, this went back. Yeah, this is most of us study NF-kappa B and cytokines when we study inflammation and pain related things. this is Professor Bharat Agarwal, who invented NF-kappa B and IL-6, who is basically from Banaras Hindu University, who was there in MD Anderson Cancer Institute. We worked together for 2 years, and is now the current citation index is more than 2 lakhs. He has discovered a lot of biomolecules, and he has published, his publication speed is weekly 2 international publication in top 5 journal is the speed in which he published. And recently we worked in a committee, we met in a Guwahati, and he says that I've done only little, but there are a lot more to do, and you guys need to take. And according to him, Indian rasam, the ginger, garlic, and pepper are the best remedy for colon cancer. He got a NIH grant, National Institute of Health grant of 5 million for that project to prove that these 3 Indian spices can prevent colon cancer. So working with such people, I felt that what we do is very little and it is very negligible. We need to be thinking that whatever we contribute to research is very small, and we need to be doing a lot. And then probably most of you know this person, the famous Indian personality, is called the father of Indian Green Revolution. For those who are not familiar, probably know his name, is Professor M.S. Swaminathan. So is considered, he came to Norman Borlaug's death ceremony, who was a Nobel laureate, who was worked with him. And to those who are not familiar, these are some of the awards, the few awards what he has got. And he told me one thing, like whatever you do research, unless it reach the last person in the society, it's of no use. You may get a good publication, you may get a promotion, whatever you want to get in life, but unless it reach the last person in the society, that is the farmer or the poor person, your research has no value. So these are the things. And this is Dr. Soumya Swaminathan, who was ICMR president or director, and now the only Indian representative in WHO as an office bearer. And she worked on tuberculosis for pediatrics. And that's what, when we got an award, what she told us, this was when they conferred me with the Patwardhan Award, she told, Dr. Murthy, the nutrition what you work should go to a rural India for the benefit of children especially. Similarly, and this is R. Chidambaram, who was a principal advisor for Government of India for more than 10 years. So when I met all these people, all of them had one single thing. See, for me, when I want to do a research, my publication, citation, the high index journal are there in my mind. But ultimately what they all told is, those are all your personal gain. To give back to society, please do something what is useful for every man. So I personally feel that this, based on the philosophy, all know that unless we do something useful for the mankind and the society, our research has only scientific merit, not the value for it. So in agreement with what Saraswati Madam told, like whatever we do, we at the end of the day, we need to think. The recent pandemic has taught us what Ayurveda and alternative medicine can contribute to the healthcare. It is like, so far it was debating, like we have modern medicine, alternate medicine and all. We had lot of antibiotics. We had plenty of choice of antiviral drugs, synthetic drugs, but nothing could eradicate corona. Ultimately, most of us have to depend on alternative system of medicine. So there is a potential where there is no doubt about it. And each one of us, as Madam told, should take a small project and make it to a bigger story. So yeah, anything that can help to create a better ecosystem or better world for tomorrow is a true research. So that's what I realized based on them. And in simple terms, whenever I talk about research, it is about an individual perception. What an individual perceive about a concept is what makes the quality of research. There's a beautiful illustration. The 2 prisoners were asked to write what they are seeing through that window, and these are the perception. So let us decide we want to be having this perception or this perception. So this goes out of the way to help everyone and see the nature, and this is a local perception. So please have a global perception and work for a better thing. And yeah, this is something what I want to reiterate to all the students. And once we are in profession, what we think is we are the creators and we can do a lot of service and other things. But unless we document and do day-to-day research, so the humility is the strongest point to be a researcher. That means you need to be humble and be ready to learn at each point. So we all say lifelong learning. That is very much true in research. Whatever I know, there'll be still a lot unknown thing in my life. So you should have a learning intention and intuition. So the moment you stop that, you cannot be a good researcher. So that's what I learned through my journey of 20 years. And open mind is something which I thought it is lacking in many of our, as a professional. We all feel that, okay, if I discuss something with Ahalya madam or with Professor Saraswati, they will hijack my idea. No. So those days are gone, because I had all these problems when I interact. Sir, if I tell my idea, probably they will duplicate. No, nobody can duplicate the way you want to do it. Please do not delay it, do it yourself. So be open to learning and explore the opportunities. And today I work with people or scientists from Australia, Europe, and US is purely based on the trust. So otherwise, there is no international collaboration that can exist. And ability to accept the mistake. This is what I always tell them. So when I was writing my first manuscript, I had like 6 to 8 revision. So I was learning how to write. Even the recent one I showed, it is 112th paper. Still, I have to revise it several times. So I always think that other person give input to improve myself. It is not for their thing. So be open for learning and urge to create a new science and evidence. Especially in Ayurveda, we need to have an urge to create. Okay, this is not told in modern medicine, or this is not told. Let me prove it. You need to have an urge in each section of our study. And you need to trust others. Trust is something which is very important in research, because your work is read by somebody who has not met you in your lifetime. And they trust that you have done this and you got this information. Similarly, when I read literature or article, I trust the person or author who has done it. So the entire community of research works on the trust. So trust is something is very much required. And we should always be ready to accept both rejection and failure. So I always tell, the research grant rating or research publication are low probability game. When we submit to a journal, the chances of acceptance, if it is a good journal, is less than 10%. So I should be ready to revise. If there is a mistake, correct it, resubmit it, or try. So this is perseverance is what I want to say is very important for research. So we may get a lot of training, but unless you have these minimum qualities, I think it will be hard to achieve what you want. And then these are some of the synonyms which goes with the research. The simplifying the knowledge, persistence, commitment, teamwork, trust, and ethics. If you do not follow this, I don't think your research can travel for a longer distance. With this is something what my colleague Dr. Nanda Kumar, who is an excellent community medicine person, he said, sir, altogether we can say that the cognitive behavioral change is what we need to bring in everyone. So especially the medical professionals or anyone who want to be in a research, if you can bring up the cognitive behavioral change, I think all our effort, whatever we do in future, will be more useful. Yeah, so we always say that do right thing the first time. Whenever we learn it, especially those who are in undergraduate and postgraduate, don't discount on your dissertation quality. You may say that, oh, it is only for my master's or MS, MD. Let me finish the way the university wanted to. Always start practicing in the right way. It is like teaching the kids about bicycle riding. So if they learn it in a right way, so it will be there till their lifelong. So write the ethics and research right way the first time, and it will be followed every time. And this, what it can give in it's my own experience as a human being. I learned all these things through the research. How to plan everything. It is not only the research, how to plan my life, how to plan my day, everything. It will become part of your thing. And resource management. Research, one of the major thing is resource management. You need to do several studies in different parts, how to manage within the available time. So also, research can teach you an excellent administration indirectly, and it will also help you to enhance your critical thinking and ability to think differently from others. And then research always teach you alternate means, because most of the time, whatever we plan will not work. So we always learn how to approach the alternate means, and compiling the information, any information given to a person who has never done a research, it takes some time. But if you are used to that culture, it is easy for you to compile and present yourself the best way. When you present a paper or a thing, you undergo a lot of criticism and comment. So that will make you a better person to present yourself, and it will be make you a more exploratory than others. So these are some of the things what I personally feel, other than your academic degree, what university gives you, the research involving in research can teach you for self-benefit. Yeah. So ask yourself a question before you do any research. It may be a dissertation or a project. Should I take research seriously? So you need to know the research cannot be taken as a half-heartedly. So I'll do a research. Let me finish my mentor or teacher's satisfaction for only satisfying my teacher. Never do that. So just ask a question. If I want to do it, get involved completely. What is the issue? Try to understand the issue at your own level. Don't interpret the paper by somebody else and the way they want. You understand whether that problem you can understand and contribute something. Until you understand the problem, you cannot get involved seriously. Then you want to do a original research, or you want to improve something what is available, or value addition. We call it as repurposing in the modern medicine. So what is that you want to do? Stick to this and start, because the original research always takes a lot of time and effort, and it is also the accidental thing. But improving the existing thing and the value addition is quite possible with limited resource. Decide on what you are planning to do. Then, what is your primary target? Apart from obtaining your degree or satisfying your teacher, what are the target for yourself? What is that you want to contribute? And do you think the problem you have taken is a serious issue in the community or in the society? So otherwise, we'll be taking a rare disease and working on a rare plant or a rare drug, which may not see the daylight in your lifetime. So try to see the relevance of the problem in today's context, and how you can help. This one dissertation cannot solve the health problem of the world. At the same time, one critical information from a dissertation can change the way of thinking in the entire community. So we have seen such cases. The dissertation coming out from undergraduates and postgraduates in some of the top medical school has changed the biochemical pathways, and we have seen several examples. So please be positive when you do that. And what is the level of evidence you can provide? Like, we can't certainly provide the molecular or very deep level, but even if you identify a problem, anemia, it may be any disease in the community, identifying it in a right manner will definitely give a better outcome. And yeah, the other thing is, can you achieve something in an available resource? That is, this is where you need a collaboration and work with different people to achieve a bigger thing in a smaller resource constraint. So please keep this in mind and work towards the research. And this is something which we always feel that each one of us want to have the best guru in the world. So if the guru is good, we can all learn. So it is in terms of research, it is bidirectional learning. I always feel that I learn many things from my PhD students or master students. So have that faith with the teacher and teacher with the student. So it is always a bidirectional, because we are learning advanced thing. It is not the textbook information we are learning. We are learning new. It is open resource. Sometimes the younger generation pick up it very fast compared to us. So keep that. Respect should be through the knowledge. So the moment you learn more, automatically, even if you are not a big the title, the respect automatically follows. And mutual agreement for the concept. I have seen many dissertations and the research work, the time and efforts are wasted because of the argument. Come to a common conclusion, have the same mindset with a mentor or a collaborator, then you can get a better thing. And make a sincere and ethical effort. We all know that what is the ethics in research, probably in one of the training will. So always follow the ethical, moral values to take the research and never quality. and never try to misuse the outcome of research for a commercial purpose unless otherwise it is meant for such things. And credit sharing should be ethical. If you want to acknowledge anybody, so I have seen several clinical studies. The first line of acknowledgement says that I acknowledge all the patients who are a part of my study. See, what a beautiful way of acknowledging the thing. And I have seen a paper without acknowledgement for a bigger study also. Try to acknowledge everyone who is part of your contribution without subject what observation we can make. So please make it a habit in your routine thing, and should always lead to a long, whatever you do in a small scale, please keep a longer in not only professional in a research outcome, and definitely things will follow. Yeah, this is I remember this Ramayana stories. Each one of us think that, oh, mine is a small research, how can I help? So like each in building the Lanka bridge, if each monkey had thought that I don't contribute, there wouldn't be Ramayana happening. So similarly, each of your theses will contribute. Nowadays, it is going to Shodhganga. All of your dissertation are going to Shodhganga. Shodhganga is projecting it in a Government of India's portal. Say that each one of your dissertation is contributing to the science and knowledge of Indian. So make sure that your dissertation is highly valuable and it is respected throughout the world. I was thinking like my dissertation will be dusted in university office. No, now the things have changed. Please keep that in mind. So because when we submit a dissertation, once I get a certificate, I was thinking it will be dusted in the university office. So now your dissertation is projected throughout the globe. So have the responsibility of ethics as well as your achievement also. And yeah, so this is what I go as a researcher and advisor for many universities. Current what we are is like I see a lot of dissertation and research work which are redundant, repetitive, and regressive. I see one person has done a model of some activity to using the plant X, other person will take plant Y. There is no rationale. So please stop it and let us make it more applicable and more original and progressive, and let it be more futuristic. But what is the way we have in between? We have to do all these things within the ambit of this. We are working for academic rating and new education policy. Let us use all of these advantages and make it more applicable to the future generation. Yeah, especially for Ayurveda, I just wanted to, so we have a lot of opportunity. Unlike modern medicine, we are not at the end of the road. We are still traveling in a open road. We have a lot of opportunity to create the evidence, and the lack of concept understanding. It is not explained to the modern or Western people the way they should and interpret it. It is very difficult for us only to interpret a lot of our shlokas and this script. So let us understand in the right direction and put forward. So that is a big lacuna in translating the information that needs to be going to the Western world. And it is the only means, research is the only means by which you can promote the application of Ayurveda. And we have intelligent consumer. Before they come to doctor, they would have seen several Google pages and they are more educated. So have a better knowledge of integrative medicine before you treat. That's possible only if you get involved in original research. It is an open system of approach. Now, anybody can opt for alternate medicine or Ayurvedic medicine. So whenever we are giving, when we have open system, it should be more competent and convincing. So these are some of the opportunity compared to other field in Ayurveda. So I think you can use these things for our thing. And when you say that if you want to be somebody who want to be a researcher and want to achieve a lot of things, I'll just quickly share my own story. So yeah, this is my journey. Like 1993, I did my B.Pharm, and 98, I did work for an industry. So initially, I told no, it took almost 8 months to finish the draft of my first paper, and which was published in 2000 out of my dissertation. And I did file a patent from Central Food Research Institute in 2004, I think. Then after this, it took almost 3 years to get my 25th paper, and then 50, and even now I have, even if I don't go to office and work here, my collaboration, my students will give me another 20 paper by end of this year. So we have set the ball, and it took almost 20 years to come to this stage. And I have not done anything. I was not a teacher. I was full-time researcher. So once you get into the track, I think it goes by itself. The collaboration, the way, even now, I told through Unnati, we need to publish at least 4 or 5 articles by end of this year, because they have voluminous data and they are looking by means to present it to a modern world. So we will all learn together. I told ma'am, like, don't treat me as a resource person. I am also a learner. Let us learn together. And if there is some mistake, we'll come to a conclusion. First, we get convinced, then we try to convince the outsiders. So with these few words, so this is just to give a moral courage that every one of you are capable of achieving bigger thing if you want to do a research. And as I told, to conclude my presentation, I always consider research as a lesson and lifelong learning. It will not end. I cannot say that I have completed the research. It is a lifelong learning, and ethics and commitment are part of research. You cannot forego this, whatever may be the circumstance. Don't manipulate and don't misinterpret, or don't unethically do any kind of research. And please own your research from the heart and say that it is my concept and I want to. And all the research need not solve the problem of the humanity, but it can show a road to solve the problem. And then focus locally with the global resource. And we all know that local approach is what we need in today's context. And mentor-mentee relationship is like marriage and the Guru Shishya thing. The more meaningful, you can get a better outcome. And research evidence in complementary and alternate medicine is the need of the hour. So these are some of the few things. Before we start the training, I wanted to tell, because my last 15 years experience with the medical faculty and Ayurvedic faculty, I think some of these information are nowhere taught in the textbook or nowhere told by anybody. It's all, we assume that it is already understood. I thought I'll bring this context and make the platform for better understanding. With this, so thank you for the opportunity. If you have any 1 or 2 questions now or at the end of the presentation, I will be happy to address it. It is whatever I shared has no science in it. It is my own experience. That's why I gave the disclaimer also. It is my personal opinion. So please take research seriously and own the research, and definitely each one of us can do wonders. Okay, thank you.
Thank you, sir. Now, I would like to invite Mr. Shivaraj Ennis. Excuse me. Now, I would like to invite Dr. Nandakumar V.S. Shastri, Head Research and IPR, Ramaya Medical College, Bangalore, India, to deliver the speech on Research Design and Execution, Clinical and Population Studies. Over to you, sir.
Thank you. Am I audible? Can I continue, please?
Yes, sir, you can continue.
Yeah. Thanks a lot for the organizers, Unnati Foundation, the Bangalore Zone of Ayurvedic College Principals Forum, Saraswati ma'am, Ahalya ma'am, the seniors of the dais, the participants who have given this opportunity for us to share our perspectives in this very interesting forum of understanding research and the pre-conference workshop for research in alternative medicine. So over the last 20-25 minutes, you have been hearing to my colleague Chidambar Murthy, Saraswati ma'am, who have sort of like dedicated their lives to the cause for what they are working on. Research for many seems to be a means to an end, probably as a part of their postdoctoral thesis or a mandatory requirement of a course where they would be required to submit a particular thesis or a dissertation or a coursework, which would be essential for them to get that degree. But when you hear to people who have dedicated their lives for research, you would understand that it's not just means to an end, but it's an end by itself where you learn while you are doing things, and it goes beyond the call for passion for that particular subject. So in that context, over the next 10 or 25 minutes, rather than looking at the theoretical aspects of what to do, I mean, like what is good to be done, let us just get into a little bit application-oriented knowledge of understanding the research design and execution of research. I'll share my screen with you. Hope the screen is visible. Can one of you confirm whether the screen is visible?
Yes, sir.
Okay, thank you. So what I would be covering during the next 10-15 minutes is need for research, research approaches, what is meant by a hypothesis, the clinical and population approach, the difference between the two of them, why we need to understand bias as an important factor which will have a huge bearing on your research outcomes or outputs. What are the research designs that you can adopt, especially from alternative medicine point of view, and the steps for execution of research. Because we did go through the training that has been planned for you over the next couple of days. You will be hearing about the research methods, research designs, the statistics, which Dr. Shivraj is going to talk about. So in that context, whenever we undertake research, many a times it would be to confirm what is already known, to discover new things, repurpose an existing solution in a different context, redefine a particular understanding that has already been sort of like set in stone, how to relook at it with modern tools and techniques. And of course, the current wave is that of innovation, where we are looking at entrepreneurship and innovation in bringing out new things. So in this context, we need to pause a little bit and understand that the major differences between the lens of allopathic research and the lens of Ayurveda or what we call traditional sciences, that there's a different fundamental approach. Being a allopathic medicine trained doctor, for me, if a patient report has A, B, C, D parameters, based on that, I try to make some inference and I'm going to treat. So the approach towards that is largely different from a system which looks at individual, the Tridosha, or the entire thing is different. So I very vividly remember hearing one of the stalwarts of research say that you are using the wrong scale to measure the football field. Because many a times we take a 6-inch ruler and say that the precision, the sensitivity, specificity. But when the very approach, how a particular thing works is different, and if you apply a scale which is not even meant to measure it, then how are we going to say that whether it works or does not work? So that is the first and foremost difference. You should understand that, like, begin with that end in mind as to what you want to achieve by understanding and undertaking this research. So in that sense, like unless you have a clear-cut focus on that particular end that you want to achieve, and I'm not saying that it is just your thesis or getting a degree. In your research, you need to very clearly define in an unambiguous way. When we speak about the IMRAD and the methodology, I will give that thing, but it should be very clear for you to understand what needs to be done. So largely there are two kinds of approaches when you look at research or reasoning. These are reasoning approach. The first one is the inductive reasoning. The other one is the deductive reasoning. So usually inductive reasoning is the act of making generalized conclusions based off of specific scenarios. Suppose, as Saraswati madam told, this person came with A and this was the thing that was done. So it can be similar for other patients as well. So it is like making generalized conclusion. Like many times as clinicians, we go by syndromic approach. If A, B, and C are there, then probably the entire people who are suffering from A, B, C have that disease. On the contrary, the other type of reasoning is the deductive reasoning, where the act of backing up a generalized statement with specific scenarios. So here, what we do is, like, for example, like a marketing plan that would be effective for a specific audience. So we know that like mass media, digital interfaces are popular among youth. So if we want to convey a message to adolescents with regards to screen time, then probably we are going to use the same thing. So we have a generalized statement and we are applying that to a given specific situation. And also when we look at the various types of designs that we have, so these inductive, deductive, and mixed methodology, in modern medicine or in allopathic research, we have this action research. And today, believe me, each website or each book that you read would have classified the types of research in multiple ways. So what is basic at a given situation might be seen in a different lens in another situation. So in that sense, so inductive research is largely action research, ethnographic research, where they explain the social world, research subjects inhabit in a way they would. So each scenario would require a different approach, is what the slide, what I'm trying to convey. So having known this, like usually when we start, this is what I was saying, we start with a hypothesis. The word seems complicated, but what is hypothesis? It is an intelligent guess. Most of the time we understand this hypothesis as a scientific guesstimate based on certain axioms. We would have heard, we would have known, or from an earlier exploratory studies, we would have found that there might be an association proving that causality is hypothesis. And there are different methods for framing or developing a hypothesis, like method of difference, where if we see that two people are going to the same hotel, one person comes down with gastroenteritis and the other person is not having it. So what is the difference? It might be in the food that they consumed. One ate idli, the other person ate dosa. So the person who has eaten idli has vomiting and diarrhea. So probably the difference there is the probable cause for that outcome. So based on such difference or agreement of a particular thing, we formulate a hypothesis to the effect saying that probably X is a cause for Y. Similarly, when we look at concomitant variation, this is called as dose gradient. Whenever we see a larger quantity of exposure or consumption of a particular thing, rises or gives rise to an outcome. So in modern medicine, again, I'm referring to a lot of examples from allopathy because that is where I come from. Consumption of dietary fat in higher proportions leads to coronary artery disease. There is a correlation and also a causal association established that higher the consumption of saturated fat, higher is the risk for developing coronary artery disease, as evidenced by increased levels of triglycerides, low density lipoproteins, and other measurable lipid fractions in the peripheral blood. Similarly, method of analogy refers to what happens in one scenario might be applicable to another scenario. So we have certain cancers which are common in lead exposure. So paint industry is one place where lead is was used earlier, and we know that lead causes certain types of dermatological malignancies. So in another industries, acid batteries, lead acid batteries, if someone comes with occupational dermatitis and dermatological cancers, we can say that since lead was implicated in another situation, probably even at this situation, we will be having the same kind of a thing. So these are the methods with which we will be framing the hypothesis. The reason I'm saying this is specifically when you are taking up any research topic in alternative medicine, so you need to understand that the modern lens is based on a structure of either proving or disproving a particular hypothesis. So in that sense, it is very difficult to prove what is not there. So if you state a hypothesis that drug A or drug B will cause this effect and then there is no effect, it is very difficult to prove. Again, when I speak to my friends or colleagues in the RISA, Ramaya Ayurvedic Center, they're very clear about what they're saying. They say that, sir, unlike in modern pharmacy approach, when you look at PKPD or a drug as a single molecule, here it is a mishrana, it is a rasayana which has synergistic and combination of effects. How can you isolate a single molecule and attribute it to a single effect? So that is where you need to see that. Please don't ape what is being done in another system of medicine. Each system is unique, though the scientific approach remains same to avoid bias, to find out the truth and quantify it. Please don't use the same techniques or the scale, what I mentioned earlier, to frame your hypothesis so that you can either prove or disprove. Again, these two things, directionality and quantification, are extremely important in modern pharmaceutical industry, where they say that equivalence, drug A, remdesivir, is as good as ivermectin. It decreases the chance of severe COVID and death as a consequence by almost 40%. We are quantifying it. But that might not be the true in other cases where, as Saraswati ma'am was saying, it's something which is not even measurable. Then how can we say that 30% reduction? Okay, so please be clear about what you want to measure. So from that, coming to a clinical approach, usually the clinical approach of research, when you're looking at either improvement or outcome, it would be at the patient-centric or individual-centric, which again, I've been given to understand that always it has been a personalized medicine or individual-based medicine when it comes to Ayurveda and certain systems where the focus is the individual. We are not preparing something like one size fits many. In fact, the approach has been to assess, categorize, make for that individual, which today, after thousands of years, we are talking about only omics, genomics, proteomics, metabolomics. So in that context, whenever you are trying to approach an individual patient-centric clinical focus, it will become a disease-centric approach, where we know that, okay, homeostasis or the restoration of the balance between the elements to that optimal level is what you need to bring. So you're trying to bring that homeostasis in a given situation. So in that context, clinical approach for me as a public health person seems relatively restrictive. When I'm using this word, I'm using it with caution, relatively restrictive, because we are looking at a small single focus and trying to do a lot of things around it. On the contrary, when you are looking at population approach, it is largely focusing on the entire universe of population from where these patients come. And when you look at health, which is more common as compared to disease, and look disease amidst health, the whole equation changes. So it is not just about finding the disease, it is about restoring the health, which is what the concept of wellness or prevention in terms of primary, secondary, and tertiary that we take. So in this context, whenever you are looking at it, you need to be aware that the Rose paradox, or Jeffrey Rose, who was an epidemiologist, says that determinants of disease in an individual is different from the determinants of disease in large populations. So what do we mean by it? Diabetes, Madhumeha in Rama or any one individual, Pushpa, is not the same as diabetes among Indians. Though Indians are made of all these small people and small populations, the determinants of the lifestyle what this individual has might not be the same when you look at a population prevalence of that particular condition, for the reason that the population determinants will be non-health related as well. Access to healthcare, traditions, culture, food habits, so many things are there. It's not just about the prakriti of that individual alone. So in that sense, whenever you're taking up a study which would look at 1 minus X of this clinical thing, please consult experts in that field, especially the statisticians, for you to get a representative sample, which Dr. Shivraj is going to talk, and also subject experts who will be able to help you in identifying those non-health determinants which might be having a bearing on the epidemiology of that particular condition in terms of distribution, determinants, and also the frequency. The whole approach of research in a what we call as any modern scientific process is to avoid these multiple layers that come in between identifying the truth from the association. So what do we mean by it? If you know that by consuming a lehya or any medicine, if this thing is going to improve, whether it is the effect attributable only to the medicine or something else. So what comes in between the actual truth and the smaller things is called as bias. So bias refers to the systematic error that creeps in any of the studies and alters the measure of association and its validity. So there are several errors. We will not go into it. Causal association itself is a very important and complex topic to understand, and it is important in multiple fields for the reason when you look at prevention, to avoid the cause is to prevent the effect. So in that context, while you are looking at designing a study and designing a research, please be aware that there might be multiple factors. Confounding factor is a very big thing which you have to avoid while designing in whatever field of medicine that you are going to do research. And while we are talking about good science, like Murthy just mentioned, publications are important, scientific publications are important. There is a huge bias because of this race towards publication. Believe me, for the reason while we are trying to quantify citation index, H index, and other indices, which are very good. I'm not at all saying as a modern medicine scientific researcher, they are important to quantify, compare, and use to assess the quality. But at the same time, they bring in with them certain deficiencies and difficulties which have been put in these two books. If you get a chance, please read this book by Ben Goldacre called Bad Science, and also Denialism by Michael Spector, where you will see that, like, if you do something very meticulously in the wrong way, the outcome will be far more devastating than not doing it at all, which is very, very important. Because when your experimental methods are not suitable to find out something, like I told the scale, and you say that there is no association, and 10 people publish that there is no association, actually when there is a true association, you are killing that particular science. So please ensure that, like, whenever there is non-replicated studies and publication biases are creeping in, especially when you don't have a strong evidence base. So what do we mean by evidence? In evidence-based theory and axioms, we say that, like, whatever the expert opinion, I have treated 10 patients, I found that this is a very good cure. Harshna with turmeric with pepper and something for COVID. Believe me, when we saw through this, in fact, Murthy used to get 100 calls a day asking, sir, turmeric, you are an expert working on curcumin. So does it kill the coronavirus? So it's an expert opinion at best. So when you go into case reports, case control studies, cohort studies, randomized control trials by allocating people into 2 or more groups, looking at that effect, which is can be attributable without any bias to that outcome, you will be able to say that yes, turmeric has an anti-inflammatory and an antiviral property which can have a bearing on reducing the disease. And also, when you put together 100 such studies across the world which have been done correctly using the right sample size with the correct measure of error, you will be able to say that this has an effect on a particular outcome. So the last thing which I would want to say is about the execution, which is very important. You will be hearing about it in the next 2 or 3 days when you get to know about the methodology part of it. The first and foremost thing which is extremely important is your protocol. So what do we mean by protocol? It is a written document of your research execution. How, where, when, what you will be doing will be written. The reason we say is to have a written protocol is like having the script of your movie before you start shooting it. If you don't have a script, usually what happens, whatever you shoot, the story will continue like a Kannada or a Hindi mega serial. Even after 2 years or 3 years, when we switch on the TV and see the characters, they will be still Balika Vadu or something where nothing would have moved. So please have a script, a written script and a protocol where the IMRAD, what we mean by it is an international approach for introduction, methods, results and discussions. So usually this is a standard template where you give an introduction, the objectives of that research will be given very specifically, which are SMART we call, specific, measurable, appropriate, replicable and timely. So the objectives when you write like this, I'm not going to go into depth because for each of the thing you need to have examples, and for your own studies, you need to create SMART objectives in a workshop mode. And the methodology should be clear and precise for the reason, if you do the same thing just by reading it, or if somebody else does this using the written instructions, the procedure and the process should not change. The results can change, but the procedure and process should not change. And we have 2 more important components of the protocol or execution. One is the data management plan. The other one is the statistical analysis plan, which you will be hearing in the next session. And we need to have a clearly defined measurable outputs and outcomes, what comes out of the study as an output and what you infer and you do as an outcome, and also how it is going to impact the original population or the hypothesis that would have set forth. And the last is to give a dissemination plan. What are you going to do with it? As Murthy told, it's not just something you finish, get a degree and publish and keep quiet. You need to continue and have a dissemination plan to ensure that there is further progress of whatever you're doing. So to summarize and stop here, research approach can be different for different scientific fields, domains. What is applicable for physics might not be the same for biological sciences or neurological sciences or any other domain. But the temper and the process part and the scientific rigor that it requires, repeatability and whatever we have just discussed, needs to be ensured in almost all the approaches so that the bias is avoided and what you get is measurable and replicable. So I would like to stop here. Once again, thanking the organizers. If there are any quick questions, we can take it now, or we can handle it at the end of the session. Thanks a lot. Thank you.
Thank you, sir. Now, I would like to invite Mr. Shivaraj N.S., statistician, Ramaya Medical College, Bangalore, India, to deliver the speech on basic statistics you need to know. Shivaraj N.S. has completed his postgraduate in statistics from University of Mysore in the year 1995. He has also completed international postgraduate program in epidemiology from University of Tampere, Finland in the year 2012. Presently, he is pursuing PhD from University of Tampere, Finland. He has worked as a software professional from 1997 to 2001 in developing standalone application software. He has more than 20 years of academic excellence experience in teaching of biostatistics and epidemiology to undergraduate, postgraduate students and faculty members for multidisciplinary streams of medicine, dental, and health management. Also, he is guiding the medical, dental, nursing, and pharmacy UG and PG students and staff members in their research activities like designing the study protocol and data analysis. He is being a member of staff and student research committee member, gives suggestion in improving the study protocol. He has published 21 research articles in national, international, index journals, and also authored a chapter in textbook of publication. We are honored to have you here, sir. The stage is over to you.
First of all, I thank you for giving me the opportunity to speak you. Yeah, okay. I was given. Fine, okay. I think online also there are students. Fine, thank you. Okay. I was given a topic of basic statistics. You need to know. Okay, so definitely I'm not going to teach anything about the statistics here. So I'll just tell you about why statistics is required in a research. Okay, so just as before coming here, I'm just reading about the. Oh, yeah. Okay. So just I read that Ayurveda can treat even chronic diseases such as cancer, diabetes, arthritis, and everything. But one thing is, yes, it lacks the evidence. And most of the people say that, yes, it is because we don't have evidence on that. So that's why we doesn't use that. So even my wife also uses, but so far, I doesn't believe because there is no much evidence. But right now, yes, because after my wife has used many medicines from the Ayurveda, yes, I've started believing it. But still, it needs the evidence to show that there is a proof for that, for curing that one or whatever the thing may be, right? For that, you need a lot of research. So only research can prove or create an evidence. So later you should start saying that evidence-based Ayurvedic medicine. Okay, you should start saying that also. Yeah, let us see that where all, yes. So for being to be as a good researcher, you should have sound knowledge on statistics. Otherwise, yes, you cannot get a good outcome from this any research. Okay, so definitely from the beginning in any research, in all the research part, okay, from this design till the end, a statistician help is required. Everywhere he has a role. Let us see where all his role is there. So if you know that one, so that you can take a help of the statistician. Okay. Just in this session, I'll be just telling you about what are the application and what statistics can do in the research. Okay. Okay, it helps in, yes, estimation of a normal range. Any character has a normal range, right? Whether you take a pulse rate or a BP or anything, because every person has a different pulse rate or BP, right? So we need to find out what is the normal range. So yes, statistics can help that to find out what would be the normal range. Yes, and comparison, definitely we come across comparison of two different treatments. Okay, and to find out which is the better one, or is the both treatment differ or same in the success rate, or all those things can be achieved using statistics. So there is mathematics cannot prove that. Okay, mathematics cannot prove that. Yeah. Right, thanks. Yeah. Yes, second is a comparison. And the third thing, yes, to find the causes. Always, yes. After comparing, you know that there is one drug is better or poor. Then next question is why that drug is poor or whatever thing may be. You need to find out the causes for that. So these things it helps actually. You know this one, yes, definitely. And apart from this in the research, yes, Yeah, thank you. Yeah, why? Get the result out of that. So nobody would accept it, right? Definitely you can say that. But if you take a large sample, yes, the question comes whether ethically it is allowed or not. Ethically, definitely it will not be allowed. Okay, the subjects are not guinea pigs. Okay, you should for any study always you should take an ethical clearance. So definitely ethical clearance definitely they would ask, and what basis or what is the scientific basis you have taken so many samples. They'll ask that question. So in statistics, yes, there is a method how much sample need to be taken. Okay, there is a method. So you should ask the statistician, so how much sample need to be taken for any study before starting the study? Yeah. So finally, in the sample size, everybody would ask the question that what is the rationale for or what is the scientific basis for taking that sample? That is the main question. Okay, always you need to look at that one. Why or what is the scientific basis for taking that any sample? So for sample size, yes, definitely I am not telling more about this one. I just finish up with 3 points. So for any sample size, yes. See, like a sample size is not a random number or a magic number. Okay, it is based on some scientific methods. Okay, what are the requirements for that sample size estimation of sample? Because when you start a research, so definitely you'll have a question that when you go for a statistician, you'll have a question that what are the requirements for estimating the sample size. If you know that one, you go with that. Otherwise, you just go blind. So definitely a statistician will send you back. Okay. So whenever you go for the statistician, you should go with these things. So that is parameter variation under parameter which you are studying. Like suppose if you are trying to find the prevalence of diabetes or anything, so you should go with from the reference article how much it is there from the earlier studies. Okay. From the earlier studies, how much prevalence of diabetes is there in any study in the community or anywhere. Okay, you should have that knowledge. So that is what we are trying. Variability parameter under study. You should go with that. So next is margin of error. Margin of error means so definitely when you do that, but definitely you may not get the same result. So you may get plus or minus 1 or 2%. So you should go with what precision I need to get the result. Okay, so that is the second thing you should. So that is obtained by looking at many articles. Okay, so it is not just like it is not a random number. You should do this literature review, and then you should arrive at this how much margin of error you can take that. Okay. Yeah. Lastly, finally, accuracy. How much accuracy? Always least result. Yes, you come across false positive, false negative, which you know already, right? So how much in your result you can allow? So you should go with that. Normally, yes, if you don't go with this also, we can normally it is 5% alpha error is acceptable and 20% beta error is acceptable. So then we fix that one and then estimate a sample size. Okay, so that is the minimum. This minimum we should fix it. Okay. So these are the 3 things we should keep in mind and go to the statistician. So why randomization? Yes. As Nandakumar was saying that bias, right? To reduce the bias, randomization is required. Randomization means it's the scientific process of allocation of a study subject into 2 or more groups. Like we have 2 treatments, right? And you have 40 subjects. So like now 20 subjects has to be given treatment 1 and 20 subjects has to be given a group. So which 20 subjects will be given treatment 1 and which subject will be given treatment 2 will be a question. Definitely will be the question, right? So for that answer to that question, there is a method in statistics how to allocate the treatment for the subjects. Which subject will take a treatment 1 and which subject will take a treatment 2. So there is a method in statistics. We will give that. This will reduce the bias as well as you will have an equal subjects in both the group. So this is assured in randomization. Yeah. So these are some of the things in the research we need. There are many more things out there. Just at the end, I'll just tell about those things. But before that, just let us look at what are the basic things which you need to know when you're looking at the articles. Okay. So when it comes to the analysis of data, yes. There are different things when you look at the articles. Yes, it will be normally like you see the mean, median, or median survival time, or all those things, many different things. Why there are different things are there? That is the question, right? So why different things there are there? You need to have a question for that. This will answer. Okay. So in biostatistics, we have two parts. One is a descriptive statistics, and the other thing is inferential statistics. So descriptive means it is describing a data. When you have a large data, so we have to describe it with only single value to make it more meaningful, right? So that is called as a descriptive statistics. So inferential statistics means drawing the inference. Suppose if you are comparing, so between the boys and girls who are heavier, suppose if that is a question, we want to infer, right? How to infer that? So based that using a statistical technique, we infer. That is called as inferential statistics. Yeah. So when you look at in the descriptive statistics, yes. So we'll have a question that, okay, let us see the 2-3 data. Let us see how to describe this. We'll have a different data. Okay. So look at this data that is giving a hemoglobin level. Okay. So this is gives a hemoglobin level. This is one data. Look at the other data. That is, this is the duration of hospital of any patients. Okay. Suppose in both the places, if you use the average or mean, which you say as a mean, would be very wrong. Okay. In the first case, yes, definitely you can use a mean. In this example, yes, to describe, yes, you can use a mean. But if you want to describe this one, if you use a mean, what happens? So definitely you would may get 12 days or something like that. But which is not. Because if you look at it, most of the data are 3 to 4 days. So average should have been 5 days or 3 days to 3 to 4 days. But if you calculate average in this data, you would make it 12 to 13 days. 12 to 13 days. So if you say like that, then nobody would come to your hospital, right? So that is the question. So how to describe this then? So there are different methods are, okay? So there are different methods are. Here normally we describe it using median, okay? Clear? So now suppose average itself is not sufficient by describing the data. We look at even a variation between the data. Variation between the data. How much variation is there? Then only it will be complete. Okay. So for the, normally we describe the variation in terms of standard deviation. Okay, in terms of standard deviation, because in any article you may read as standard deviation. That says that on an average, how much variation is there between the data. I think if you read an article, they would have given in mean and standard deviation. Standard deviation stands for on an average, how much variation is there from one data to another data. Okay, I think you understood what is standard deviation. So when I describe while describing the variation of this data, we don't use the standard deviation again. So when you use mean, we use the standard deviation. When you use median to describe the data, so we will not use standard deviation to describe the variation. We use interquartile range. Because in an article, when you read, so you would read as IQR. You would have read that, right? So it is whenever the data are skewed, so we use IQR to describe the variation. You should know these are the aspects you should know when you're reading an article. Okay? Why they are described in terms of median IQR, why they are described in terms of mean and standard deviation. All these things question are there. There's many things are there. Okay. For example, let's suppose if you want to find what is the average duration or what is the survival of any patient who have undergone a kidney transplantation, let us say. So there, this also won't help. Mean or median also won't help. So there are different methods are there. Okay, there are different methods are there to estimate the average for survival of patient who average survival of any patient who have undergone kidney transplantation. Okay, so why I'm telling these things, because yes, you should know that there are different things are there. Okay, there are different things are there. So when you are analyzing or when you are reading an article, you should know this one. Okay, you should know this one. So we should ask the statistician, sir, whether it is appropriate or not. Which is an appropriate one? Which is an appropriate one? Or when you are critically reviewing the article, you should understand whether they have done correctly or not. Okay. So these are some of the basic things you should know. Okay. Because in any article, if you look at, so there will be only two things. One is a descriptive, that is a describing the data. And lastly, inferential statistics, a p-value. Okay. For inferential statistics, you have only a p-value. Okay. So how to critically think about that? Just I'm telling you, right? Just how to look at that. So this I just. Okay. Now here it is displaying different. Yeah, okay. Fine. Okay, this is about the descriptive statistics, describing the data, hemoglobin level. So normally this is how we should describe. Okay, this is how normally we describe 9.8 gram percentage with variation of 2.3. Whereas for the duration of hospital stay, we describe in terms of like 4 days with IQR, that is 3 to 7. Normally, any patient if you take 4 days they stay in the hospital with a ranging from 3 to 7 days. Okay, there are different ways are there. For different data, we describe in a different methods. So when it comes to statistical inference, okay, when it comes to the statistical inference, that is inferring. Okay, so here if you look at the data, so we are comparing the two treatment success rate. Okay, we are comparing two treatment success rate, and we want to infer that is there any significant difference or is there any significant difference in the treatment success rate to say that whether treatment 1 is better than the treatment 2. How do you infer that? How to infer that? If you look at any article, you see only p-value. You would see only the p-value. P is nothing but a probability, chances, just probability is nothing but chance of occurrence of any treatment with respect to this one. Okay, so let us not go in detail about what is the p-value. For that, we need some of the theoretical aspects. Okay, I'll not talk about that here. Okay, but only thing is, so whenever the p-value is normally less than 0.05, normally we say that it is a statistically significant. Okay, so this is what inferential statistics. Okay, so normally give only so descriptive. In any article you take, they give a descriptive and inferential statistics p-value. Okay. Okay, basis for statistical inference. Okay, in statistics, only one thing is there which is a basis for any our inference in the statistics. Okay, that is a normal distribution. I'll not talk much about that one. So for any statistics, if you take any book, you would see this graph, right? So this is the basis for all our statistical inference. Okay, normal distribution. How normally the data are distributed, based on that only we have created the theory or criteria for drawing conclusion. Okay, this is the basis for all our statistical inference. So you should read about this one, and then later let us see that whether we can get an opportunity. I think if you have a theory part in the subject, you learn more about the normal distribution. Not okay. Okay, so that is about descriptive statistics and inferential statistics. So like coming back to where all in any research process, in each and every stage, the statistician help is required. Okay, let us see what are the stages are there and where all the statistician help is required. Apart from whatever I've said, sample size randomization, and statistical techniques. Apart from that, also there are many other places where statistician help is required. Yeah. So we have these stages are there. That is, first we define the problem, and then we design the research, and then we collect the data, and we do the analysis, and we publish or we prepare a manuscript or we present the data, right? So in all the stages, yes, we have the statistician help is required. Okay. Even in the problem definition also creates the problem, as Nandakumar was saying. So creating a hypothesis, right? So creating a hypothesis also, even statistician help is required. How to make hypothesis and all those things. Okay. So when it comes to research design, yes. When it comes to research design, yes. So in a questionnaire development also, how should be the questionnaire? Okay, how should be the questionnaire? So there also statistician help is required. Suppose if you design your own a questionnaire, so definitely anybody would ask what is the validity or what is the validity of the questionnaire, right? So always you should validate the questionnaire before you start any research. For that, you need to do a pilot study on whatever the design questionnaire, and then you should. There are many validity measures are there, like space validity, concurrent validity, and all those measures are there. So you should see all those validity, and then only you should be accepted. Otherwise, you cannot use that questionnaire. But there also statistician help is required. And coding of the questionnaire form. Yes. So in any questionnaire, suppose if we have a questionnaire, so if you're not coded, so coded means yes, sir, the questionnaire, yes. So normally in any questionnaire, okay, I won't see these things. So like numbering. Why this numbering? Because okay, today we are analyzing the data using any computer or statistical software. So computer can understand only the numerical language, right? So if it, then the data also should be in the numerical methods. Numerically, the data should be there. So for that purpose, when I have designed the questionnaire itself should be coded form. Okay, so this is called as a coded format. Like for gender, okay, while entering the data, if you click this male, so the person who is entering the data will think that he will enter only one. Okay, you can't enter male. Suppose if you enter male, sometimes you may enter as male and capital letters or small letters or only some MA, like that. It will be different. So always it should be entered only one code, that's a numeric code. You should give a code and then it should be entered. So this is called as a coding of the question. Okay. So similarly, even this is this thing. And this also. So normally I've seen that everybody collects with yes, hypertension, diabetes, thyroid. So they would have given 1, 2, 3, but they would have taken all the 3. So while entering the data, so then they would enter 1, 2, 3. So it is not a numerical value. So it has to be entered in, or it has to be designed this way only. It has to be designed this separate variable, and then it should be entered. Then only it will be correct. Okay. So in this place also, you should take a statistician help, and then they will help you how the data should. So because they know that how the data should be when they are analyzing the data. Yeah, when data collection, yes. When it comes to data collection, yes. Sampling methods. So patient recruitment. If you have a large data, out of that you may have to take only a small sample because you would have sample size is fixed. Like we have okay, this much sample has to be taken, and you have large samples or large population is there. So how do you select it? So that to ensure that a representative sample you take, right? So that is the most important part. Otherwise, again, it will be a selection bias. So all these things has to be addressed even in publishing the article also. You should need to write down this, how the population, how the sample has been selected and everything. Okay, everything should be there in the manuscript. Otherwise, it will not be accepted. And randomization process. So normally randomization process comes in clinical trials. Okay, not in any population study, but in a clinical trials. So treatment allocation. So there the randomization process comes into picture. So that is in the data collection. When it comes to data analysis, okay, when it comes to data analysis, yes, Dr. Kumar was saying that to prepare a statistical analysis plan. Always you should, after collecting the data, you should prepare a statistical analysis plan. It is a structured plan, okay? Dummy tables or what is the tables, each and every table you have to prepare, and so that you should give to the statistician so that he will analyze and give it to you. Okay, so you should have an idea how to analyze. If you want to have that idea, then you should have the idea of what can be done from the statistics. If it doesn't know that, so you'll not know what to do with the data. Okay, it will be garbage in and garbage in. Okay, so you should have a better or sound knowledge of a better idea what data. Okay, let us leave it apart from that one. Okay, in data preparation of analysis, a lot of checking has to be done. Okay, a lot of checking and missing data need to be checked. So when it comes to statistical software, okay, yes, there are many statistical softwares are there to analyze the data, like SPSS, JMP, R. So SPSS and JMP are there is a cost for that, okay, but whereas R, it's a freely available software, okay, freely available software. For others are very costly. Yeah. So as I was telling that, okay, the data should be in the numerical format, right? So this is how the data should look like, okay? When the data is in the Excel, so this is how the data should be in the numerical format, okay? So complete data should be in one sheet and completely should be in the numerical format. So these are some of the things you should keep in mind when you are analyzing data. Okay. In the report preparation, yes, this is also important. Here also statistical help is required. So how the table should be represented, A lot of things are there in this also. Okay. And also graphs, when to give graphs and when not to give graphs. So I have seen that both will be given. No. So if you give the tables, you should not give the graphs. Maybe in the thesis you can give, but not in the publication. Okay. In the thesis, yes, they expect to give both. You can give that, but not in the publication. Yeah. So these are some of the things where the role of statistician is the research process. Okay. So always in any research, okay, you should take one statistician as a co-investigator. Always he also know that what can be done in the process. Okay, what analysis has to be done, all those things you will have an idea. Otherwise, if you give it to him, so it will be like whatever you say, so it will be done. Okay, it will be done only whatever you say. Suppose if we keep in a loop, what can be done and everything. Okay, so always it is better to have a statistician as a co-investigator. It will be an advantage for.
I would like to request Dr. Kishore Kumar, our Professor of Ayurveda, National Institute of Mental Health and Neurosciences, Bangalore, to speak on the topic Research in Ayurveda, Opportunities and Challenges. Dr. Kishore Kumar has completed Doctor of Medicine, Ayurveda Vachaspati in Kaya Chikitsa from Sri Dharmasala Manjunatheshwara Ayurvedic Medical College, UP, Rajiv Gandhi University of Health Sciences, Karnataka in the March 2003, and worked on diabetes mellitus. He was the first Ayurveda postgraduate to receive Doctor of Philosophy, PhD degree from prestigious NIMHAS, Bangalore, on the topic evaluation of heart to establish Hridaya Dushri, cardiovascular dysfunction in Vishada, major depression patients. He has published more than 40 research papers in various journals. He was conferred with Young Scientist Award for Clinical Research by CCRNs. He is keen to integrate Ayurveda concepts with modern neuropsychiatry. We are proud to have you here, sir. The stage is over to you.
Thank you, Dr. Sindur, for those kind words. Respected teachers, Dr. Halia ma'am, my colleagues, my dear students of Kalabarishwara Swami Ayurveda Medical College and Hospital, and my dear friends. I thank the organizers for giving me this opportunity to present before you the research in Ayurveda opportunities and challenges. So, what exactly am I being expected of in this topic is something which is very difficult for me to analyze. So, to make it a little more interactive, what do you think is research? Can anyone volunteer to just speak up? Anybody? Make it fast. I have only 30 minutes. So, and what is that you want to know? Anyone? Do it fast. Somebody in the front? Yes. What is the special focus that you want to know, or do you want to know in general? Here I agree. Nobody wants to talk? Yes. Speak in general, it's okay. Question ಕೇಳಿದ್ರೆ ಬೈತಾರೆ ಅಂತ ಹೇಳಿದಾರ ಟೀಚರ್ಸ್ ಎಲ್ಲ ಮಾತಾಡಿ. I think somebody should. Okay. Fine. I'll cover some of the general aspects of research in Ayurveda. Have you heard of National Library of Medicine? Have you heard? Is it Indian National Library of Medicine? Okay, there is something known as National Library of Medicine, which is hosted by the US, and it actually comprises of all the articles of research that are done or published. Research, if you have done, it needs to be published. Only then they acknowledge that you have done some research. There are 27 million articles till date. How many? 27 million articles till date. And among the journals which are hosted by the PubMed Central, which is one of the platforms that hosts, you have heard of Google Scholar? No? Google Scholar. Yeah, it's another platform. So you have different platforms that host the research that is conducted by all the researchers, students everywhere. And there are 27 million articles. And how many among them are or concentrate on traditional systems of medicine or Ayurveda? Have you seen? Till date, there are only 6,000 articles. Only 6,000 articles among 27 million articles that are published in PubMed. Not that research is not going on, but then somehow we have missed, or very badly we have missed the bus. Not many articles coming on PubMed. What is hindering this, and how many journals are listed in PubMed? There are only 3 Ayurveda journals which are hosted in PubMed. You know which of them? So how many of you want to pursue research as your career in future? You can't lift hands. You can lift hands like this. No need of speaking. Like this you do. Nobody wants to pursue research as a career. So thank the organizers for giving this opportunity. Nobody wants to? Please raise your hands. Good. Nobody wants to. Have they been instructed something in specific that they should not? Nobody wants to pursue research as your career. Okay. Now, what is this research? How it is being done? Okay, I'll explain some basics. It is some simple mathematics being applied to biological sciences. What you do is you try to establish something which is working, which is not working, or whatever, on a certain group of human beings or any organisms, either animals or humans. What you have to ensure is there is homogeneity in these groups. Okay, which are the confounding factors? Which are what factors make a particular group different from another group? Can somebody answer? Okay, I take one group of individuals belonging to the age group of 18 to 30 and another group of individuals belonging to age group of 80 to 90. How does this group differ? Age. Why should it make a difference? Because there are so many factors that change in these age groups. Simple example is, let us say, physical endurance. You know what is physical endurance? An 18 to 30 can run a little faster than 80 to 90. Okay? Which means that their metabolism and different other factors differ from one group to another group. So that is a heterogeneous sample. So how do you make it homogeneous? You take 2 groups of the same age group. Fine. If I take one group of females and another group of males, how does it differ? By gender. Okay. So the metabolism in females is different from metabolism in males. Fine. So you can't have a conclusion of any study. Fine. So that is when we try to make this group. So you make 2 groups homogeneous. And this group should be representative of the population, right? Because why you are doing research is to find out that something what you are saying is true or false. So if you have to say that, you have to do it on the entire population, right? So mathematics or statistics gives you a solution. It says that you can take a group of the population which is known as representative of the population, And if you prove that in that population, you can extrapolate it to the population. And that is when that is how you do a research on a specific number of people. And generally in a research, there are two groups. Fine. Now in one group and another group, you make it homogeneous. And in one group, you give them an intervention. What do you do? An intervention. You give something, some medicine, maybe Sitopalatichur. Okay. Does it work in reducing the symptoms of cough? And another group, you give them something else along with Sitopalatichur. Do you know that in a simple dry cough, Sitopalatichurna might work? So that is known as standard of care. Right? Standard of care. Anyone comes to you with some dry cough without any complications, you give them Sitopalatichurna and send. So this is what is the standard of care. You want to try another churna whether it acts in the same way. So what do? You give to another group the same churna. Okay. So you are comparing one drug that is working. You know that it is working, and you are comparing it with another drug which you want to see if it works. Fine. So then after that, you analyze. My previous speaker sir was talking about statistical analysis and so on. How many of you paid attention? How many of you paid attention? So he was talking of sample. What is a sample? Okay, what were the statistical softwares that he was talking about? One or two? Fine, good. So you analyze the data. The data says that the cough reduced as much as Sitopalatichurna works. So which means that your churna works as much as Sitopalatichurna. Is known as non-inferiority trial. It works as the same. Okay. Now this is, you are comparing it with a control, which is a standard of care, which is generally known as the positive control. There is something known as placebo control. You know that? You give your XYZ churna to one group, and into another group, you give something which is inert, that does not have any activity on the body, and compare. That is known as placebo controlled trial. Now, how do you make sample representative of a population? You do something known as randomization. You know what is randomization? That a patient or anyone falls into a group is by chance, by random location. So when you random, in the sense, you make a random table so that anyone comes to you can take either this or that in a random manner. So that makes it randomized. That makes it representative of a population. Fine. So that is a step 2. After you randomize, you have decided the age, you have decided the gender. You will say people belonging to either sex. Then you randomize them, so that becomes the representative of the population. Fine. So after that, you start your intervention, then collect data, as sir was saying, do a statistical analysis and see if your drug works. So this is known as clinical trial. Understood? You know what is a clinical trial? So interventional clinical trial is what I was speaking of. Now there are so many models of trials. So what is known as randomized? I told you what is randomized. I told you what is controlled. Controlled is either a placebo control or a positive control, or a control which is standard of care. Okay. And you randomized. Now what is blinding? What is blinding? Pardon? Good. Somebody started speaking now. So you have a blinding wherein the patient doesn't know what he's taking. It is known as single blind. Okay. The physician also does not know what the patient is taking, is known as double blind. The rater also does not know. Rater is the person who assesses. He also does not know it is triple blind. Generally, double blind studies. Okay. So double blind, placebo control, clinical trial is gold standard trial to prove whatever you are trying to establish as efficacious or something. Okay, this is known as double blind RCT. This is the standardized or gold standard research trial to prove whatever works. Now, this is about very briefly about clinical trial. There are so many other researchers in drug, in observational, in correlation, in observation, so many other things that are done. But now the point of contention or the point of lacunae is that we do not have enough publications in terms of RCT. Okay, now you want to do a clinical trial to see if Vamana works in Tamaka Shwasa as compared to standard of care in the allopathic system of medicine. Can you do an RCT? Why? Can you do a randomized placebo control? Speak up. It's okay. If yes, why? Okay, she said no. You are nodding your head horizontally, so that means no. So, why? No. Okay, in any clinical trial, why is the blinding done? Okay, to avoid error or bias, which means if the patient, there is something known as a psychological component. Okay, if you tell a person that you are going to get well, don't worry. Okay, there is a kind of reassurance, and that makes him recover. So to avoid, that is known as a confounder. That is why the patient is blinded. The physician is also blinded in some time so that he does not bias. Fine? Because if he says that you take this medicine, it's very good, tomorrow you'll be all right, the patient will go home and he will experience better, start improving. So to nullify those confounders, you blind. So that the patient doesn't know, the physician who's administering does not know, and then you give. So if you want to try out Vamana in comparison with standard of care in allopathic medicine in a randomized control design, is it possible? Why? No, he can, no problem. He says, I want to undergo Vamana, he can. What happens is, if you are giving him Vamana, the patient comes to know that you are doing something. My wife is being given a tablet and an inhaler or something, and you are doing a lot of things to me which I don't understand, which is very weird. What is this? You have to tell, otherwise he'll say, he'll run away. He'll say, oh my God, they're making me sick, they're trying to make me drink liters of milk. What is this? So you have to tell that you are doing some procedure, and you have to explain that it is Vamana. So he knows that he is taking an Ayurveda treatment. So the concept of blinding goes. Correct? So blinding is not there. Then how do you do a placebo in Vamana? For Vamana, for example. For a placebo control, you can give a tablet which is inert. Let's say you can give a small starch, okay, to one group with the same color as the other one. And this is what you're taking, you're randomized, you mix them and you give, okay. So in the end, you de-blind or unblind, then you will know whether the patient took the placebo or whether the patient took the medicine. Then you will know which acted, correct? Now in Vamana, how do you do a placebo?
Fever drug is not actually causing pneumonia. Biggest one the classics and fever drug initiates vomiting. Reports or studies which show
No, we are comparing it with a standard of care, like bronchodilators, antibiotics, and so on. So here you are comparing it with Vamana. So you give him a drug that doesn't cause vomiting, means he has not done Vamana. So that is not placebo. You should do something which causes Vamana but doesn't have the effect. Even then it is not possible. Okay. So the challenge is to design placebo control. Okay. In many of the Ayurveda studies, because it is not so many. When a patient comes to you, with a complaint of low back ache, you're going to tell him 100 things. You do yoga, or we will give you something known as Basti, which is Yoga Basti. Then we will give you Kati Basti. Then we will give you 2-3 tablets, 2-3 kashayas. Okay, he's taking a whole lot of things. So in that case, there is multi-dimensional approach. So to design a placebo is very, very difficult in traditional systems of medicine. Even yoga for that matter, he is going to do a yoga module and then you can't design a placebo. So that becomes a limitation. Okay. So for that, there have been various committees that have proposed what you can do. One is multidimensional treatment, and there are different diagnostic categories we have. Let's say, for example, you have in mental health, if it is schizophrenia that you are diagnosing, we call it Unmada, but then our classification is totally different. And the classification of ICD in terms of mental health is totally different. So you'll have to derive a commonality there. So that is another challenge. And then there are approaches. Each patient is given a certain treatment based on a lot of factors that we already know. Isn't it? It's not that a patient comes, you give them this particular dosage based on a particular body weight. That doesn't happen. So under all these circumstances, we have the task force that has come up in the sense they say that you do pragmatic studies. Pragmatic studies are studies which are real life studies. You give a patient a module of treatment and see if it is working or not. And then factorial designs, multi-factors. So you have multiple dependent variables and multiple independent variables. So a patient might be belonging to different prakritis. So in prakritis, you need to elicit response of a particular treatment. And these treatments can be multifold. For some, you can give Vamana. For some, you give only Shamana. For some, you do some external therapy, different. So you have multifactorial design. And then there are something known as preference trials, as you were saying. Patient is allowed to take either yoga or Ayurveda or standard of care. You cannot randomize because there are preferences. Some patients will say, no, I am not going to take Ayurveda because I'm not very sure. So you can't leave him out. So that is preference trials. End of one trial is a case study where you see a patient and do a pre and post and observational trials. So these are trials that are still allowed as very good evidence for trials conducted in medicine or especially traditional system of medicine. So then these models are to be used, and you have to conduct the study and derive a report of what happened and then publish it in some platform. Then they say that you did this, this was what the result, and it helps others to look at how the study went on, whether they can carry forward from there or not. Okay. So when you come to traditional systems of medicine, you have various. I'm not here I just wanted to give you an example of how a concept can be thought of in terms of modern evidence, and then do a trial, and then still establish the concept as well as the effect of any treatment. So we did a very small study effort in this regard. So all of you know what is Vishada? All of you know what is Vishada? Sadness, or it is known as depression. Okay. So most of the people of your age group go into this phase either little or more based on the psychosocial stressors around you, correct? So all of you might have gone through and come out also. So don't think of going into it again, fine? So this is a manovikara, we understand. It is also described as one of the Nanatmaja Vatavya. Okay. It is a manovikara, it is a Vatavya. Now Vata we know has its action on Manas. And Manas Adhisthana has been told as Hridaya. And Hridaya has been interpreted as the brain as well as the heart. Fine? You are convinced with all this? Vishada is a manoroga. The pathophysiological factor behind it is Vata. The Adhisthana of Manas is Hridaya. Hridaya can be considered both as mind and also the heart, right? And then Tair Alpasatvasya Mala Pradushta, you might have heard. Buddher Nivasam Hridayam Pradushya Srotamsi Adhishtaya Manovahani Pramohan Tyashuhu Narasya Chetaha. This is the general samprapti of Manoroga. Fine. So you have Manas, the Adhisthana is in the heart, and there are different doshas which cause the etiology or pathophysiology leading to Vishada. Okay. Then there are references which connect Shiras and Hridaya. Murdhanam asya samsivya atharva hridayam chayat. So there is a connect between Murdha and Hridaya. Dugdhambuvat sammilita vubho tulya kriyo manasa maruto. Manas and Maruta, that is Vata. It's very difficult to differentiate because they have gotten together like water in the milk. Okay. Then Yato Marut Tatra Manah Pravrittihi, Yato Manas Tatra Marut Pravrittihi. So you have direct indication of Vata there. Indriyani Manonatho Manonathastu Maruta. Right? Indriyani Manonatho Manonathastu Maruta. You understand, no? In the controller of Indriyas are Manas, and the controller of Manas is Vata. So then you have to take care of Vata. Okay. Then Shoka is another synonym of Vishada. Shoka has been mentioned as Hridroga Lakshana. In people suffering from heart diseases, you have Shoka as a presentation. And in patients suffering from Shoka, Hridroga has also been mentioned. Okay. This was the concept we took. Now, how do you try to find out evidence in the current evidence system? So we found out, or when we look at the literature, it is regulation in depressed patients is useful indicator of increased cardiac mortality in depression. In depression, heart diseases are more. That's what it says. And then depressive patients have neurohormonal dysregulation, which are seen by autonomic function tests. Fine. Next, when you look at autonomic function tests, now the hypothalamus, you know the hypothalamus in the brain? Heard of it? Okay. Now this has direct action on sinoatrial node. Now sinoatrial node generates some impulses. It generates impulses, the heart rate, in the rate of 600 milliseconds each beat. Okay. If it is, that is 100 to 60 to 100 is the range of heart rate. We understand that? So this is based on the impulse that is generated by the sinoatrial node in compliance with the hypothalamic inputs. Okay. So this variation can be measured. Suggest what? The status of your mind when you are extremely tense or stressed, your heart rate goes. So what the theory says is, if your heart rate is varying, you are adaptable. If the heart rate is not varying, then you are not so adaptable. So when you are under stress, your heart rate becomes constant. It raises to a threshold and remains like that. When you are at rest, your heart rate is varying. Why? Because it makes you, or it helps you adapt to various circumstances. You have a sudden impulse, you know how to react. But then when you are under stress, you either hyper react or you don't react. So when you want to react, then your body metabolism should give you that much support. So there is a method wherein you can measure heart rate variability. And if you measure heart rate variability, which is direct function, direct control of autonomic nervous system function, you know that in stressed patient, the heart rate variability is less, doesn't vary. In patients, in people who are healthy, making you more adapt. So in depression, we found that the patients, the normal in depression, we found that the patients of depression, they suffer from very, very decreased heart rate variability. And this is directly a function of the hypothalamus and nervous system. So we equated the nervous system function to the function of Vata, and this nervous system in stress and depression was correlating very well. And autonomic hyperactive depression, and this is the reason for increased cardiac movement. So he said Vata, Hridaya, Shiras. Okay, Vata is autonomic functions, Shiras brain, Hridaya is cardiac autonomic functions, and Manas the functioning of psychiatric or the domain of psychiatry as such. This correlation was achieved. So you have a concept, you can use some of the logic to compare them to a particular proof of evidence and prove that. So we conducted a study and we took out the heart rate variability of normal individuals and compared them with the patient suffering from depression. So very clearly we got that in normal individuals, heart rate variability was more, and in patients suffering from depression, heart rate variability was less. We gave them some Ayurveda medication, and after a particular time that the trial design had, the patients decreased, the symptoms of depression came down. Along with that, the heart rate variability improved, which means these medicines didn't act on Vata as well. And we did this correlation and published it. It was accepted. So there is why I gave this example was that we have so many concepts like this. And when we have these concepts, when we have to present it, there are a lot of questions we need to answer. And these questions need to be answered mandatorily. We have no choice because Charaka has said, okay, we always use the habit of using our Acharya. Our Acharya. Why is he not Acharya of others? Is he only your Acharya? So you're bringing in a feeling of ownership of Charaka. Charaka doesn't know that his name is being misused, or Sushruta. That how this works, because Charaka has said. Because our Acharyas have told in their particular Samhitas, it should work. If it doesn't work, you don't know, or you have failed to understand. This mindset from here, you should come out, stop using our Acharya. Fine? State and then test it. So when you want to do a randomized control design, you can still do if it is one specific drug that you are using. And you design a placebo for it. And based on that, you do a placebo control design. And when you want to try a multi-dimensional approach, then you cannot. Okay. So studying these becomes invariable now because I will make my own world doesn't work because we will finally land like Trishanku. Nobody will be able to see. It is Ayurveda. We have our own journal. We have our own platform. So you don't worry. Okay, you stay there. So then when you look at the other journals and articles published, there are a huge number of them which are published in terms of Ayurveda studies. But nobody looks at them. That is the problem. You need to publish in journals which others can see and say, oh yeah, I know, I have read your study. So that becomes very, very important when you do a research. So whenever you are planning to do a research, more and more people should start pursuing research as their career. Wherein we said that a lot of, I know now the trend has changed, but at least 10 years back, Ayurveda colleges hurgiri jasti. There are 100 intake, 75 of them are girls. Fine. 25 of them are boys. Okay. Now among the 75 girls, what happens to 60 of them is a very good marriage prospect. Nan magadu doctor. So innobru yadavaru cardiologist gun hudkana anta tande tayi plan madu. Fine. Then okay, 60 of them get married, and after marriage, ene marta idya, you ask your classmate. ಏನೋ ಒಂದ್ ಸ್ವಲ್ಪ ಅದು ಇದು ಓದ್ತೀನಿ ಕಣೋ ಹೇಳ್ತೀನಿ ಇದ್ರ ಆನ್ಲೈನ್ ಅಲ್ಲಿ ಲೆಕ್ಚರ್ ಕೊಡ್ತೀನಿ ಮನೇಲಿ ಏನ್ ಮಾಡ್ತಾ ಇದ್ವಿ ಮನೇಲಿ ಚೆನ್ನಾಗಿ ಓಕೆ ದಿಸ್ ಈಸ್ ಹ್ಯೂಜ್ ನಂಬರ್ ಅರೌಂಡ್ 60%. 15 of them, yeah, still they get into. Boys are the poor people, you know, most suffered class. ಆ ಕಡೆ ಆಯುರ್ವೇದ ಹುಡುಗಿರು ಮದುವೆ ಆಗ ಯಾಕಂದ್ರೆ ಗೊತ್ತು ನಮ್ ದೇವರ ಸತ್ಯ. ನೆಕ್ಸ್ಟ್ ಏನ್ ಮಾಡೋಣಪ್ಪ, ತಲೆಗೆ ಹೋಗ್ತಾರ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಿದ್ರೆ ದುಡ್ಡು ಬರಲ್ಲ, ಯಾರು ಬಿಲ್ಡಿಂಗ್ ಇಲ್ಲಿ ಕಟ್ಸಕ್ಕಾಗಲ್ಲ. ಹಾಸ್ಪಿಟಲ್ಗೆ ಹೋಗೋಣ ಅಂದ್ರೆ ಏನು, MD ಮಾಡ್ಬೇಕು, ಅದಕ್ಕೆ ಬೇರೆ ಎಂಟ್ರೆನ್ಸ್ ಬರೀಬೇಕು. ಸೊ ಅರೌಂಡ್ 25 ಅಲ್ಲಿ you have around 5 people who still pursue with lot of struggle and go ahead. The others try looking into 10 to 15 people who actually are in the profession. This is the reality. You see the CCIM registration, around 5.56 lakhs is the Ayurveda registrations, practitioners. And do you see them on the field? Very, very less. So, a lot of people, many of you, opportunity now because you have a novel concept in hand. You have ಎಸ್ಪೆಷಲಿ ಕೋವಿಡ್ ಬಂದ್ಮೇಲಿಂದ ಆಯುರ್ವೇದಿಕ್ ಡಿಮಾಂಡ್ ಜಾಸ್ತಿ ಆಗ್ಬಿಟ್ಟಿದೆ ಈಗ ಗೊತ್ತಾ? ಆಯುರ್ವೇದದಲ್ಲಿ ಏನೋ ಇದೆಯಂತಲ್ಲ. So then, this is rising, not only COVID, even before that, there is a strong, now they ask for evidences, we don't have evidences to show. So it becomes pertinent for us, very contextual, very relevant that all of you try your maximum to stay in the field. Most of you should try and get into research because the prospects in research in Ayurveda and traditional systems of medicine have risen. So finally, before I end, I'm going to tell you what we are doing. We were the first institute in the country that looks at a patient, at the level, a yoga expert, an Ayurveda expert, a psychiatrist, and a neurologist. They consult the patient at the same time and optimize the treatment to the patient. What is better? Now, to give you an example, if there is a patient who comes to you with depression, and if it is very mild, we try to give him only yoga for a certain days. Then later, if there is some aggravation or there is some increase in severity, add some Ayurveda medicines. But then when he goes back, then he develops psychotic symptoms, add psychotropics. And during the process, you look at if there is drug interaction between Ayurveda and modern, or how are they being synergistically acting or are they individually acting. So this is the endeavor that we have started, and through this, what is the role of each system of medicine in terms of intervention in mitigating the effects of any of mental and neurological diseases, and to what extent. So this is the first attempt that we are doing in terms of this research. I encourage you more rigorously than what is it now. Thank you very much for providing.
Now I would like to request Dr. Nayan Kumar, Professor, Department of Agada Tantra, to grant Dr. Kishore Sir, Professor of Ayurveda.
You can, I'm sorry I exceeded my time. I have put my, I think they have my email ID. If you have queries, you can post them to my email. Thank you.
Thank you, sir. Today, we have with us one among the eminent personality of Ayurveda, Dr. Ahalya Sharma Madam, Principal, Government Ayurvedic Medical College, Bangalore. She was also a principal of GMC Mysore. She has been nominated as a member of Traditional Knowledge Digital Library, that is TKDL, New Delhi. She is a member of Task Force for Health Group Vision Group, Karnataka since Jan 2021. And also, she is a member of PG Board of Studies, Kerala. She was also a joint director, Department of Ayush, Government of Karnataka, and also served as Deputy Registrar, Department of Ayush, RGHS, Bangalore. She is a very good motivator, mentor for all the Ayurvedic graduates and undergraduates who came out from GMC Bangalore. A very good practitioner with unique approach in the management of OBG and other neurological disorders through Ayurveda. She was also awarded with Nada Prabhu Kempe Gowda Award from BBMP during 2018, Yugadi Puraskara Vashana Mahile by Sharada Sevika Sangha, Bangalore, New Generation Vocational Excellence Award from Rotary Club Bangalore. And she created public awareness about COVID-19 pandemic during lockdown under Arogya Bhagya Health is Wealth program of Department of Ayush. She was also awarded as Best Teacher from JSS Mysore, the CEO. I'm humbled and honored to welcome Dr. Ahalya Sharma Madam, Principal GMC Bangalore, for conclusion and briefing.
I think before that, we should congratulate from the SCIC staff, faculty, student, as well as management. Give a big hand. Dr. Ahalya Sharma has appointed as chairman for other. I think Dr. Sindhu has missed that point. Like yesterday, I think art as came. That's why we heartily welcome her. Thank you.
A very good afternoon to all my dear students first, to all the faculty, my dear friends in this institute, Dr. Anjali, Shreyas, Dr. Nayan, and everyone else, to the management and my salutations at the holy feet of the Divine Three Acharyas, and a very big Abhinandan to my dear brother, Dr. Kiran Gaur. My dear students, it feels extremely nice to be with all of you this afternoon. You have all read Yukti, which says of a dosha called Punarukta dosha. When you study Shastra, am I right? Where should I stand? Am I stand here? When we look at the Shastra Lakshana, there is a problem which says Punarukta dosha. That is, we keep repeating it again and again and again. It is like your mobile, you switch it on, you call your friend, and it says COVID-19 ki vyadhi, Amitabh Bachchan's voice comes, isn't it? And you want to mute it until it is all over, because they want us to know. The idea of organizing this research, this program, was to tell us that we have to evolve with time. And we need to bring in the necessary changes. I did not carry a mobile with me 30 years ago. I did not have a cordless phone with me 20 years ago even. It is a later addition. Mobile is a 15-year-old addition. But I changed. Now my whole life depends on that. In a very similar way, you know what the name of your college was in 1996 when it was started? Sri Kalabheshwara Swami Ayurveda Medical College. Then it became Sri Kalabheshwara Swami Medical College, Ayurveda Medical College, and the hospital. And now what is the name? Research Center. Why is that added? When did the International Day of Yoga come into existence? 2000? Come on. 2000? Okay, do you remember the date? Very good. 21st June? You are on the 17th batch, right? Yeah, you just completed your 10th standard and joined PUC 2015. So that was the year it was recognized. And why did 170 countries accept it? Only because of the evidence we were able to build up, and the whole world had accepted. People said, okay, we want yoga day because we have used yoga in our practice. We have found yoga to bring down anger. We have found yoga to be of use in etc. conditions. And that is the kind of evidence. As Dr. Kishore very rightly said, I have everything, I know. And all that people spoke since afternoon, I could pick out a quote from Charaka. Vina tarkena ya siddhi yadricha siddhirevasa. Tarka is what? Logic. Without logic, without your proper inference, the conclusion, the steps required, if you get a siddhi, if your treatment is good, you have given paragraph and incidentally the patient conceives, you think you are right? It is just a Kakakadiya. If I can say, okay, the Shruti of Palagrata matches the condition of the patient, therefore, this patient is doing well, then I can say, yes, you are right. Okay? On the other hand, we have They say, look at it like mantra samprayokta. Don't look at it at all, just accept. This is the way forward for us. Internally, I am convinced about the Shastra that I am studying, but for the sake of the world and to help larger number of people, after all what did Charaka say at the beginning, Natmatam Nabhikamatam Adhabhutadayam Prati, to bring this knowledge to the entire world. And everybody spoke about COVID and Ayurveda. None of the other advertised milk YouTube channels or others. Everybody was asking about our pepper turmeric. So this is where, why did we do? Because we lacked evidence. It is not that the medicines they used had any evidence to start off in March 2020. Particular drug works, this antibiotic works, this anti-inflammatory works. Based on that, they put it in a very similar way. It is timely with the evidence. I'm sure you must have all come across a relative in a wedding or at home who would come and ask you, are you studying Ayurveda? You have disease for, you have cure for psoriasis. And you would say, yes, we have. You would say, I don't know, whatever it could be your answer. But this is a very common question. You should come up to such a level. You would say, look, there are three publications, you refer to them if they are very educated. Otherwise, you say, look, this is the kind of evidence. Yes, I can do it. Yes, we will do it. Or we have limitations. Let's accept it. Absolutely no problem. And this is still here. We can do beyond that. As Dr. Kishore was mentioning, we have this approach. It is a very severe case of both the joints. The joints are completely collapsed. You have no chance that you come up. You wanted to send the surgery, please do it. There is an intestinal obstruction which has to be relieved, please do it. This is the time for integrated medicine in a way, and translational research is our way forward. I would just take 2 minutes. May I have the next slide? A little to move it here. Okay. So as I was mentioning, we have all become research institutes. The word translational would come from trans and ratio. That is, we need to improve, we need to move with times. In fact, every YPI is known as Kalavit because we have to move with times. And this is the kind of time that we need. And as I was saying, that's why we have this topic, because this is where you can make a career. This is going to be a part of your PG. This is a part of your UG as well. Imagine when something comes into your syllabus, it shows its importance. So this is the most important one. And you have the single case studies as respected today. You treated a very difficult case and you have fabulous results. Don't this. You record all that you have done. Day 1, this is what I gave. Day 6, this is. Day 11, this one. Day 30, this is the kind of results. You just publish it. Let people look at it in any other way. I want to go for a higher one, then let me come up with the right logic. And that is the important one. So it is across, trans is across, and ratio is to bring that which brings across newer ideas, gadgets, evidences. We have Abhikarma, we use the same word instrument. I want to have a dispenser which can give me the right amount of Jumuna. When I tell patient what do? I say half a spoon of Sitopaladi or Talisari, or I say 3 grams of Talisari. How will they know what is 3 grams? Like the way we have the inhaler. It makes a turn and it just dispenses that much that is required. We can think of so many such new ones, and that is what will make Ayurveda relevant. Don't we have the green tea today? And green tea maybe 30 years. There's some simple patta here and there, but today it is such a fashionable thing. Any high level meeting you go, they won't give you tea or coffee. They say, okay, we give you green tea, we give you lemon tea. So that is the change. When I was learning yoga in the 80s, people would come and tell my mother, why are you sending your daughter to all that? No. Why go to that? I go to the yoga, she teach yoga, whatever is the yoga we follow. So that is what is important, where we are able to bring it from bench to bedside. where we are able to patent something, where we can make a policy decision. My dear students, please remember, we don't have one national program that relates to Ayurveda. Swarna Prashna can be chosen. So many such ideas can be generated. And for that, we need research. For that, it is not that we just need some research and some policy. We want you to inculcate that research mindset. I have another few years of to be your teachers. So you guys take up this idea, get that mentality, start questioning. This diploma in that, let's put an end and say, okay, diploma for an undergraduate student would be this. Diploma for a PhD student, yes, you go exploring. Let's come down with about many of the other ideas that should be practiced. So the entire way forward for us would be to get into a research. Something is wrong. I'm unable to get it to move. Yes. Okay. So this is what I was mentioning. In fact, this is the Shalaka Dr. Santosh has made it this way. So from basic research to bedside to policy and practice. That is what we should be looking for if Ayurveda has to be there. And if you all can make a great career of this with pride and with purpose. So that is what matters, and that is the way forward. Teamwork for project thesis, similar just the way we have for engineering students, and concept to consumer, project to product, and the actual manifestation of translational research. We shall see more of this on Sunday, and offering my thanks to all the people who have organized Unnati, Kalvaiveshwara College, blessings of Swamiji, all the staff who have put in their efforts, time, and to all of you, my dear students. I end this speech wishing each one of you the very best, and may you get that. Kalidasa said, Purana Nityavana Sadhu Sarvam. Never did we agree anything just because it is good. Nachapi Kavyam Navamitya Vadhyam. Because something is no, I'm not going to delegate it. I'm not going to say it's not okay. We need to make a mix of the two. ಹೊಸ ಚಿಗುರು ಹಳೆ ಬೇರು ಕೂಡಿರಲು ಬರಬಹುದು. ಹೊಸ ಯುಕ್ತಿ ಹಳೆ ತತ್ವದೊಡೆ ಮೂಡೆ ತರಬಹುದು. ಋಷಿ ವಾಕ್ಯದೊಡನೆ, as if it is meant for Ayurveda. ಋಷಿ ವಾಕ್ಯದೊಡನೆ ವಿಜ್ಞಾನ ಕಲೆ ಮೇಳವಿಸಿ ಜಸವು ಜನಜೀವನಕ್ಕೆ ಬಂದುತ್ತಿಲ್ಲ. So with these words, wishing each of you inculcate that spirit of research, that spirit of inquiry. After all, the word pariksha that you studied in Padartha Vijnana means just that, iksha, to look at it. So look at the Shastra, from the Tattva to the Shastra to Vyavahara. That is the progress we need to make. And I'm very sure with the kind of training you all get, you will be more than able to do it. Yes or no? Could I hear it louder? So wishing each one of you the very best. I wrap up my speech. Namaste. Thank you.
Thank you, Madam. Thank you, everyone. We'll be meeting on 26 September 2021, Sunday at 9:30 a.m. in the same venue for conference on holistic therapy for well-being and interdisciplinary approach. And the speakers are Dr. Raghavendra Rao, Director, Central Council of Research in Yoga and Naturopathy, New Delhi, India, who will be delivering the speech on the need for research in alternative medicine. Dr. Indranil Vasure, Staff Cardiac Electropathologist, Memphis War Medical Center, USA, to speak on role of spirituality in the medical community. Dr. Vartika Saxena, Dean, Research, Professor at Department of Community and Family Medicine, Department of Ayush, AIIMS, Rishikesh, India, to speak on achieving synergy between modern medicine and Ayush. Dr. Saraswati Hegde, Founder President, Unnati Healing Foundation, Bangalore, India, to speak on yogic healing, the need of the heart for holistic health. Dr. K.N. Chidambaramurthy, Principal Scientist, Ramaya Medical College, Bangalore, India, will be speaking on the research methodology and alternative medicine in comparison with modern medicine. And Dr. Yasumar, former Chancellor, Sri Devarajara's Academy for
Higher Education and Research Scholar India will be speaking on integrating health science education for better understanding, way forward and concluding remarks. Until then, thank you all. Have a good day.